This video is for people that are just starting their Invisalign journey, so they're either about to come and see us for their first appointment or you've just been for your first appointment. We call that first one the fit appointment, where you're fitted with the Invisalign aligners. Now there's some things that you need to know and there's some things that you can do to help your teeth move better. So that's what we'll talk about in this video. We'll give you a batch of aligners, we'll give you a series of bags like this, and the bags will say the number aligner on the front. So this is number 3 of 3. So for me in my series of aligners, there's going to be 3 total, and this is the third one. So it's important that we don't get the order mixed up. We need to make sure that we're wearing all of the aligners in the right order. So the bags do have that printed on. Also, on the chewing surface of the molars, it's also printed really small as well. So this would have a small number 3 just there. So in order to put the aligners in, I would recommend that you identify the front of the aligner. You'll be able to tell which is the top one and which is the bottom one. You'll be able to recognize your teeth, but it's good to recognize the very front teeth and then look in the mirror and try and get them lined up so that the front teeth are hovering over your front real teeth. And then you can start to put everything down at the same time. I often like to push down the front first and then push down the back teeth second, like this. There we go, and once it's down, I give it a good push everywhere. So I'll do the same with the top aligners. There we go, and they feel nice and seated. So to get the aligners out, there is a technique that we'd recommend for that. It's going to feel different to every person. Every person will have attachments in different places that makes it more easy or more difficult in certain places. So there'll be a knack to doing it and you'll become really good at taking out your aligners. When they're very first fit in, it's really difficult to get them out. When you're not familiar with where to pull, it is really difficult, but it just takes a number of days and then it becomes quite easy. So the recommended technique that we'd recommend is to approach with your fingers around the back teeth and to approach the surface that is sat nearest the tongue. So the other surface would be sat near the cheek, and we'd rather that you approach near the tongue. So to remove the lower aligners, I'd be going around here. And I just lift everything up at the back and then the rest all pops off. So for the top aligners, I'm approaching the surface that's near the palate. Like that. So I release them at the back and then just pull everything else off. If you have very delicate or very expensive nails and you don't want to put your nails on the inside of the aligner, we'd recommend buying some retainer removers or retainer retrievers as they're sometimes called. So they're just a very thin, small plastic hook that allows you to hook around the edge of the aligner and pull the aligner off. So the hardest part of the Invisalign journey is now. The hardest bit is the start. You'll find it's quite difficult to get the aligners in and out at first, but it takes a few days before you get good at that. Also, right at the start, when your teeth first start moving, that's when they tend to be a little bit painful. Not everyone describes it as painful, but I think more often than not it is. My personal experience is that the teeth were quite sensitive, quite tender. I would describe it as painful for the first few days. So if you do want to take some paracetamol, that helps. That helps things to settle down. But in the coming weeks, when you do change the aligners, because each aligner that you put in is tight again, it tends not to be painful. It just feels tight at following aligner changes. The other thing that people sometimes notice is when we put the attachments on the teeth, the little bumps of filling material that help the teeth to move, when they're fresh, sometimes the corners can irritate the inside of your cheeks, and occasionally people get ulcers. So if that does happen, just bear with it, they'll settle quite soon, and where the attachments are, where the little bumps are, where they're a little bit sharp on the corners, they very soon slightly round off just from taking the aligners in and out, and that sharper edge just disappears. When you're wearing your aligners, you might feel as if you talk differently. So anytime we put a different shape into someone's mouth, the tongue has to get used to that shape and retrain itself. So if you feel as if your speech is different, if you feel as if there's a lisp or any kind of different speech, generally no one else notices it, but you can. But actually it only takes about 3-4 days usually to adapt. We could say up to a week. So within a week, the tongue will relearn the shape of the inside of the teeth and will adapt, and you'll be able to talk normally again. So now we're going to talk about something really important: wearing the aligners. So for the teeth to move, you've got to wear your aligners, and we like you to wear them for a week for each one. So after a week, take out the one that you've just been using and use the next one in the series. Sometimes we say a different number to 7 days, but the vast majority of people is changing every 7 days. So within those 7 days, we want you to wear them for 22 hours every day. So you're allowed to take your aligners out for 2 hours a day, and that 2 hours is for eating. So keep a toothbrush and some toothpaste nearby. So every time you take them out, have your food, maybe take them out for drinking, and then you clean your teeth with toothbrush and toothpaste and put the aligners back in. So we want you to wear them for 22 hours a day. Though one of the beauties of Invisalign is you can actually take them out if you do have an important event. If you have a wedding to go to, a job interview, a date, you may well want to take them out. That's fine. That's one of the beauties of Invisalign. But be aware that the longer you have them out, the more you have to add on at the end. And the teeth will move backwards a lot faster than they move forwards. So for example, if you have your aligners out for half a day, you can't just add half a day on to your 7 days that you're supposed to be wearing them. It's longer than that. There's no exact numbers to how much longer than that it should be, but my general recommendation from my own experience would be that if you have them out for half a day, you need to wear them for an extra 2 days on top of your normal 7 days to get back to where you were. Now you'll get a feel for when the aligners have finished doing their work. When you put in a new fresh aligner, you'll find that it's very tight feeling, and then after a week, you'll find that it's looser. You'll find that it quite passively comes in and out, and that's the feeling you're looking for. So you need it to feel like that for a day or so, and then you know that the aligner has finished doing its work, and then you can move on to the next aligner. Drinks. So what can you drink with your aligners in? Well, according to Invisalign, you can only drink water, and if you want to be a really good dedicated patient, then stick to that rule. Though from my experience, I don't mind if people are a little bit flexible with that. I do think you can drink other things. So tea or coffee without any sugar added, don't add any sugar. The occasional glass of white wine or maybe glass of beer, something like that. I think this is all okay. Be aware that if you do drink tea or coffee with your aligners in, the aligners will go a little bit more murky coloured. They'll darken a little bit towards the end of the week. They won't be as clear, but it does appear as if the teeth move just as well that way. So do that at your own risk. Invisalign would say only drink water, but I would rather that you had them in for the 22 hours a day rather than taking them in and out all of the time because you're having drinks that are not water. So I'll leave that one with you. So as part of the goodie bag that we'll give you at your Invisalign Fit appointment, there will be what's called some cleaning crystals in there. So they're to be dissolved in water, and when you take your aligners out, you can soak them in the water and cleaning crystals, and this cleans them. However, it makes them taste not so good. I think there are slightly better alternatives on the market. There are other kind of competitors that you can buy these products from if you do want to clean your aligners in between using them. But in my personal opinion, because you're only wearing them for a week, you don't need a lot of cleaning. You don't really need to soak them in cleaning crystals. You can do that if you want, though my advice is that when you're cleaning your teeth, use the toothbrush on your aligners. You don't really need the toothpaste on. You can have a bit of toothpaste if you want, but I think that that's all you really need for cleaning the aligners. Also in the little goodie bag, there'll be a case for you to keep your aligners in. So this is one of the older design cases. The newer ones are black colour, but the idea is when you take your aligners out to eat, you don't lose them and you keep them in this little box just here. So that box will be there. Now, when you've finished using a set of aligners and you move on to the following week, we like you to not throw away the last pair. Because if you then lose this box, if you lose the new pair, you then have the old set to go back to then hold your teeth in position whilst we arrange for some new ones to be made. So don't throw away the last ones that you've used, and try and keep your new ones in a box like this. Also in this little box, we'd like you to keep a Chewie. We'll supply you with a couple of Chewies, and what Chewies are small cylindrical plastic Chewy toys, similar to a dog Chewy toy, that we want you to bite down on once you've put your aligners in. So every time you put your aligners back in, we want you to take one of these Chewies and chomp on it all the way around your teeth. So you start off with the back teeth on one side and have a chomp on each set of teeth, gradually moving around until you've been around the whole arch of teeth. So chomp, 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 all the way around. And it might take about a minute or so to do that. And that will really help the aligners to fully seat down, really grip around the teeth, and also the slight movements and vibrations through the teeth will help to stimulate movement as well. So every time the aligners go back in, we'd like you to do that for a minute. And then also any particular teeth that are really sticking out, any movements that we really need to happen in your teeth, you can focus on that area. So we will have talked about that in the surgery. If there's one particular tooth, for example, that really needs to move, you can just chomp on that. So ideally you use the Chewies every time you put the aligners in. And if you do find yourself with spare time, if you're just watching TV in the evening, there is benefit to just sitting there, chewing on them. 20 minutes, just chewing away, it does help the teeth to move. That brings us to the end of this video. Stick to this advice and your teeth will move as well as they can do. If you have any questions at all, please don't hesitate to call our reception and we'll be able to give you some advice.